Hi, I am going to be discussing the family health promotion model. What is health promotion? Health promotion is different from disease prevention. The focus is not avoiding a specific disease or health problem, but it rather is increasing the well-being and quality of life. Some health promotion behaviors, there's smoking cessation, reduction in misuse of alcohol and drugs, improved nutrition, exercise and fitness, stress control, adequate sleep, and positive relationships. So Loveland-Cherry and Bomer took Pendar's 1996 health promotion model that only focused on an individual and adapted it to a family unit. Why? Because familial support has been well demonstrated to be a key factor for promoting and sustaining healthy behavior. The whole family unit is important because values and behaviors are learned within the family. And health promotion is crucial for families, and health promotion increases family unity and quality of life. And in order to reach the family's greatest potential in all aspects of health, you need the whole family unit of life. These are some definitions that were used in the model. So families are very similar, but also every family is very unique, and there are very many differences. So this model focuses on how every family is very unique and each different aspect of it. So let's dive into the family health promotion model. You can see at the top there's 4 general categories. First, there's the general influences. So there's family system and patterns, power, cohesion, demographics, characteristics, size, family structure, socioeconomic status, ethnicity, culture, and then biological characteristics as well. So an example of something that would change in there is if a family lives in poverty, they would be less likely to be involved in health promotion because they are just trying to survive their day-to-day life and make through. Also, if there was a larger family size, they may not have enough resources for all the family. Culturally, some different cultures eat specific foods that are high in fat or large quantities. That's just their culture, and what they do is they get together and eat, so that can affect it as well. Also, types of foods that they use, and it's not just food related. It can be that they all get together and go to the bar every night, or they smoke, or it could be any one of those influences. It also could be for the positive influence, where every time they're together, they're doing something active and or talking to each other and growing relationships, things like that. So the next section is going to be health-related outcomes. And this is family health socialization patterns and the family definition of health. So if the family definition of health is the absence of disease, that family is not going to be engaging in health-promoting lifestyles. And if they perceive that since no one's died in their family recently, then they're healthy, that just shows how that their perception can affect their actions. And then examples of health socialization patterns, that's interacting with friends and family, being rewarded for doing good things, and being taught to obey laws. So those maybe that are taught strongly to obey laws, they would maybe be better at deterring from underage drinking or illicit illegal drugs, and those being rewarded for good things they do, maybe they're always rewarded with food or a treat, and so in their mind they always have to be rewarded with sugars. The next section is behavioral specific influences, and that comes with a whole nother list of things. So perceived barriers to health promotion and disease prevention. It could be, like we talked about, higher poverty rates makes it more difficult to function. They may not be able to participate to pay for services or programs that are available. Cultural and social norms surrounding health behaviors can affect this as well. And then low health literacy levels very much are in this category. Some other family norms that it talks about regarding health promotion behaviors is your family always going out on hikes and outings and choosing active activities together as a family to be together? Or are they always choosing, is it always surrounded by food or eating out? And perceived benefits of health as well plays a risk factor, because some say, well, you know, if your parents say you don't need sunscreen, you're fine. And then you end up getting skin cancer later in life because they never needed sunscreen growing up. Or vaccines, like I never got my kids vaccines and they've been totally fine. Things like that really can affect health promotion. And then all of these you see lead into behavioral outcomes and the health promoting behavior for the individual is all affected by all of these different categories. All of these variables are related and interrelated and affect the quality of family health. And parents have a very strong influence on what kind of health behaviors their children and adolescents will adopt. The family health model is useful because it provides the framework for understanding the level of health that families are experiencing. It helps design interventions to assist families in maintaining or regarding good health or coping with illness. And this specific model of family health can facilitate organization of the family nursing literature and be used to categorize family research. So let's look at some studies that have shown how the family health model in action can help. So some studies show that family support consistently correlates positively with those becoming or maintaining being physically active. Familial social support has been well demonstrated to be a key factor for promoting and sustaining health behavior change. Spousal support has been identified as an important factor influencing weight reduction among obese women with type 2 diabetes. Familial support has been reported effective in producing health-promoting behaviors among patients with cardiovascular disease and for chronically ill family members achieving a physically active guidelines and participating in better dietary behaviors. Another study focused on using the family to combat childhood obesity, and it showed there was many different ways the family could support by modeling, encouragement, having different access to healthier foods or no access to some of the unhealthier foods, and a physical activity variety that was shown to them. Also, eating dinner together as a family has been associated with healthy weight and consumption of healthy foods. And change in dietary practice was shown that is mostly going to happen at the family level, especially for children. And if families members are going to adopt new foods, is going to be through their family. Most of the recommendations for addressing childhood and individual obesity, like eating habits, exercise, and physical activity patterns, they're all family-based. Another study that looked at disease prevention showed that 222 diabetic women older than 50, researchers found participants reporting severe or bad family functioning were 75% less likely to undergo any annual screenings. Something I want to drive home is that family health promotion increases family unity and quality of life. A study that used this model, they tested families with children who had Duchenne muscular dystrophy, and with using the family health promotion model, found that it contributed significantly to more predictable descriptions of strengths and weaknesses not identified in general family function. And this caused family health behaviors to pass through demographics and family capacity, which then were able to be explored and expanded some control of their life activities. We have now learned how vital family health promotion is, and that the health of the family system is required to adequately promote the health of each of its members. The family does play a central role in developing and maintaining attitudes, values, and behaviors related to health promotion of its members. And this can go for positive and for negative behaviors. The family is responsible for providing basic resources that support the promotion of health in its members. And with an increased emphasis on this, the responsibility for development and maintaining of healthy lifestyles, the family has taken this role, and that's why there's been an increased importance of family. I chose the family health promotion model because it is such a foundational model for the family. And the family that I assessed, they have small children, and this is where health behaviors and patterns are learned. Thank you for watching my presentation, and I hope you learned something.